Ligament, the Tommy John ligament, can be sprained in golfers and racket sports, can really only be torn in throws. It's really only an issue in throws. What happens is that as the throwing motion comes across and as they match up coming from the cocking phase to get into the throwing phase and the follow through, that's when the elbow sees a tremendous amount of torque, probably the most torque that the body can produce. And that ligament, this small little ligament that attaches from the medial epicondyle humerus and sneaks back onto what's called the sublime tubercle of your ulna bone, that you feel back here, that little ligament has to keep that elbow from gapping open, if you will, from kind of opening up like that. Otherwise it causes pain, it can tug on the ulnar nerve, and it certainly doesn't allow the thrower to reach top velocity by any means. It's a very, very clear-cut injury. They either throw, get sore, have to come out, try to throw again and can't do it. That's usually a partial injury or a significant partial injury or a sprain. When the individual tears it, it's very obvious. They try to throw and they don't quite get the full 60 feet, 6 inches. They usually can't even reach the plate. That's usually a bad sign. The test for that, it's right, superficial palpation from the area of the medial epicondyle heading back towards the ulna bone. You can push right along there and they'll have tenderness there. Now, of course, sprain or tear, they're going to have tenderness there either way. And then what we have is some maneuvers to stimulate or to simulate the function of the ligament. And so a full extension is a stable position for the elbow. There's not going to be a lot of play going in or out, what's called valgus or varus. And so in straight, I'll test that first, just to simulate, just to make sure we don't have any pain. And there might be a little bit of pain there, but there shouldn't be as much pain as when we bend up about 30 degrees or so. That relaxes the larger ligaments and the larger tendons in the elbow and provides a little bit more looseness for you to test. And then you'll do again, and you'll put them in again. And you should feel an endpoint. On Adam, I can feel an endpoint. It might look like he's swinging open, but I can feel there, and then I'm actually bringing his arm out. There's an endpoint. Sometimes people who have fresh tears, full tears, there will be a big gap there. Not a big gap, but you'll be able to feel it clunk back is what you're really feeling. You're feeling for it going back into place with a clunk. And then the other thing is called a milking maneuver. To simulate throwing, we grab the thumb, hand comes behind or on the lateral aspect of the elbow, and what we do here is we're pulling down on the thumb, and we're pushing with our hand out this way to simulate kind of that throwing, and they should have pretty good pain coming down through here if they have any kind of ulnar collateral ligament injury. And you want to take it through an arc. They'll feel somewhat okay here, and as you get up to about 30 or 45 degrees, they'll have more, and then past 90, it shouldn't be as bad anymore. Okay, so we basically take them through this kind of a motion through here to see, and that's called a milky. Okay, and then you'd want to check. Thanks. And then you'd want to check the little tunnels over their ulnar nerve, make sure there's sensation again. Their ulnar nerve distribution that we talked about before is okay. Yeah, sorry, I forgot about that. All right. Any questions on that? Is this the group we're doing anatomy with?
Yes.
All right, so Monday night we're going to be over into the gross anatomy lab. Is there anything, if you guys have specific things you want me to point out, write them down.